Halloween is here. Many of you may have spent recent weeks enjoying some thrilling horror films, and perhaps you have plans to dive into more scary movies tonight. You might even be settling in for the night by 8 p.m. No judgment here. A notable subgenre of horror is body horror, which taps into our anxieties about losing control over our own bodies, whether to extraterrestrial beings, as in Invasion of the Body Snatchers, technology like in The Fly, or other grotesque entities like The Thing and The Blob. The notion that our bodies, or those around us, could be weaponized evokes a primal fear. There's a reason the trope of a patient entering the emergency room and unintentionally infecting staff with a mysterious illness is so prevalent. Remarkably, on February 19, 1994, this occurred in reality. A woman was brought into an ER, and upon receiving a needle, she released a toxic substance that caused those nearby to collapse. This is the astonishing true account of Gloria Ramirez, known as the Toxic Lady, a mystery that medical professionals have tried to unravel ever since. On that fateful February day, the staff at Riverside General Hospital faced a typical array of cases: a couple of car accidents, a drug overdose, and an elderly man with chest pain. Nothing seemed out of the ordinary for a suburb of Los Angeles. Then, at 8:15 p.m., paramedics brought in a 31-year-old Hispanic woman who was barely conscious and breathing shallowly. She was taken to Trauma Room 1 for stabilization. Her name was Gloria Ramirez, a cervical cancer patient. But her condition took a turn for the worse, indicated by crashing vital signs, a significant drop in blood pressure, and a dangerously rapid heartbeat. Medics administered lidocaine and other sedatives to control her symptoms, but the situation remained dire. An influx of hospital staff rushed into the room, including Nurse Susan Kane, resident Julie Gorkinski, and head emergency physician Umberto Ochoa. Respiratory therapist Maureen Welsh utilized an ambu bag to help Ramirez breathe. Yet, despite their efforts, her vital signs continued to deteriorate, prompting the use of a defibrillator to revive her heart. When they cut off her shirt to apply the paddles, they found an oily sheen on her skin that had a peculiar fruity, garlicky odor. Nurse Kane collected a blood sample, noticing an odd smell, one typical for chemotherapy patients but different enough to raise eyebrows. The blood bore small, manila-colored particles, and before Kane could voice her findings, she collapsed, reporting a burning sensation in her face. As she was hurried from the room, Gorkinski felt faint, exiting to the nurse's station where she too collapsed and began to shake uncontrollably. Simultaneously, Welch fell to the floor in Trauma Room 1, her limbs stiffening unexpectedly. This prompted Ochoa to evacuate the ER. Medical personnel rushed patients outside, establishing a temporary trauma area in the parking lot. Ochoa and a few others stayed behind, attempting to save Ramirez, but she was pronounced dead at 8:50 p.m., just 35 minutes after her arrival. Now the hospital had to uncover the cause of such bizarre events. To ensure safety, Ramirez's body was moved to an isolation room, but one orderly began vomiting and complaining of skin irritation during the transport. By the end of the night, symptoms had developed in 23 out of 37 staff members, with 5 requiring hospitalization. Julie Gorkinski experienced the most severe reaction, spending 2 weeks in the hospital and 6 weeks in intensive care due to complications like hepatitis and pancreatitis. What could have caused Gloria Ramirez to emit this unknown toxic substance that affected so many? Was it linked to her chemotherapy? Were poisoning or terrorism possibilities? Countless theories emerged, given the incident's unprecedented nature, with the case of Gloria Ramirez earning an unfortunate place in medical history. Here's what we've understood so far, and the most plausible theory presented. On that night in February, as the ER personnel treated patients affected by the incident, investigators in hazmat suits arrived to examine the area for lingering toxic substances. They looked for poisons like hydrogen sulfide, a deadly toxin. However, nobody reported the typical rotten egg smell associated with it, and investigators found no traces of it either. They also searched for phosgene, a chemical warfare agent that causes severe lung damage. Fortunately, it too was absent in the emergency room. Next, the investigators examined Ramirez's body, taking blood and tissue samples while sealing her in an airtight crate for safety. These samples were sent to the Riverside coroner, who found no alarming results and forwarded them for more advanced analysis. A gas chromatograph mass spectrometer identified several compounds, including lidocaine and other medications associated with chemotherapy. However, there were also unexpected findings such as amine, linked to the ammonia-like scent, and nicotinamide, a B vitamin, while dimethylsulfone stood out for its unusual presence in her blood, raising further questions. Having reached an impasse, the California Department of Health and Human Services investigated. Doctors interviewed 34 hospital staff members present that night and concluded it was a case of mass psychogenic illness, or mass hysteria, much akin to collective panic. They postulated that some element in Ramirez's blood instigated panic among the staff, citing the absence of any identifiable toxin, and noting that the women experienced the worst symptoms. Critics of this theory pointed out that the nursing staff were seasoned professionals accustomed to traumatic situations, making it unlikely that a bad odor could induce fainting. Furthermore, Gorkinski faced prolonged health issues, losing significant bone density, which affected her ability to work, leaving her unable to seek compensation since the report labeled the incident as mass hysteria. Consequently, she filed a lawsuit. Her legal team contacted Brian Anderson at the Lawrence Livermore National Laboratory, who initially led the analysis of Ramirez's blood. After further investigation, a colleague speculated that the presence of dimethylsulfone may have resulted from a mix-up with dimethyl sulfoxide DMSO, a potent degreaser often misused for muscle pain. DMSO could react with oxygen, producing dimethylsulfone. With oxygen introduction during medical assistance, it's hypothesized that high levels in Ramirez's blood could have ultimately transitioned to dimethyl sulfate, an extremely toxic nerve agent capable of causing serious physical reactions. This led to further testing at the lab using Ringer's solution resembling blood. They found successful results at typical body temperature, with the solution crystallizing as it cooled, aligning with the particles found in Ramirez's sample. However, the mystery of how dimethyl sulfate became gaseous remained. Its high vaporization point meant it wouldn't typically become airborne in ER conditions. Yet in this unusual case, the vacuum used during blood draws might have facilitated a small volume of the compound to vaporize, affecting the medical staff. This speculation offers an explanation for the event, but also leaves room for skepticism. Critics argue that dimethyl sulfate doesn't typically induce the immediate reactions witnessed, further muddying the water of certainty surrounding Ramirez's case. Ramirez's family remained skeptical of this theory, asserting they had never encountered DMSO and requested an independent autopsy, which was futile as her body had already deteriorated significantly. The lingering questions have spurred numerous conspiracy theories, including claims of possible drug manufacturing within the hospital. For now, the prevailing theory from the Lawrence Livermore lab retains the most clinical support, yet the exact circumstances of that night in 1994 may never be fully explained. Thankfully, since then, no similar incidents have been reported, leading to the belief that this was a uniquely bizarre occurrence. It's essential to remember that at the center of this enigma was a real person, likely a good soul, whose life ended tragically, and who is mostly remembered for this peculiar incident. Rest in peace. The human body can exhibit some truly astonishing